Hi everyone, and welcome back to my video series over cognitive behavioral therapy. Today we'll be diving into CBT for depression. Depression is one of the most common and debilitating mental health conditions. It is often affecting motivation, mood, and daily functioning. Individuals with depression often experience persistent sadness, hopelessness, fatigue, and withdrawal from enjoyable activities. CBT for depression focuses on two major areas. So, as depression often involves negative thought patterns and low motivation and behavioral withdrawals, CBT targets cognitive techniques, which is to help clients identify and change negative automatic thoughts that contribute to the depression, and is also behavioral techniques. So, using behavioral activation can help clients re engage in meaningful activities to improve mood and promote recovery. Today we'll explore how these techniques in depth focus on how thought patterns and behaviors interact in depression and how CBT helps break the cycle of inactivity and negativity. Behavior activation in depression. Behavior activation (BA) is a key intervention in CBT for depression that focuses on increasing positive reinforcement through activities. Many clients with depression withdraw from activities they once enjoyed, reinforcing their low mood and lack of motivation. BA works by identifying activities linked to positive mood, so clients will track what activities improve their mood and which ones worsen it. There's also break-in or activity scheduling, so gradually introducing small, manageable activities to increase engagement. There's also breaking the cycle of avoidance. Depression often leads to inaction, which reinforces negative feelings. BA helps clients act first, rather than waiting for motivation. Tracking mood changes is also a way BA works, as clients record how they feel before and after activities, reinforcing the idea that engagement improves mood. So, for example, a client who has stopped exercising due to depression might start with a 5-minute walk and gradually build up over time. Even small efforts can create a positive feedback loop that improves moods. Some cognitive techniques for addressing depressive thoughts depressive thoughts tend to be negative, automatic, and self-defeating. These thoughts often take the form of cognitive distortions, which reinforce feelings of worthlessness and hopelessness. These techniques include cognitive restructuring, which is identifying negative automatic thoughts. So, for example, I'm a failure, and challenging their accuracy. We have Socratic questioning, which is asking guided questions to examine the evidence for and against negative beliefs. We have thought records, where clients write down negative thoughts, evaluate them, and replace them with more balanced alternatives. We also have positive data logs, which are tracking small daily success to combat the negative biases. There's also behavioral experiments, so testing beliefs through real life experiences. So, for example, a client who believes no one likes me may be encouraged to start a conversation and observe the outcome. A common case study involves a client who thinks nothing I do matters. Through CBT, they explore exceptions to this belief and find evidence to counter it and gradually shift their mindset. This can be done through Socratic questioning, for example, asking, how would I respond if a friend said this about themselves? Next, we'll look at addressing the behavior problems in depression. Depression doesn't just affect the thoughts and emotions, it can and tend to lead to problematic behaviors. These behaviors are such as social withdrawal, procrastination and avoidance, neglecting responsibility, and even self-sabotaging behaviors. CBT interventions focuses on breaking avoidance patterns so we can encourage clients to take small steps towards re-engagement, developing routine and structure. So depression disrupts normal daily functioning. Behavior activation helps reintroduce in structure. We have improving problem-solving skills. So clients often feel overwhelmed and avoid decision making. CBT teaches structured problem-solving techniques to help tackle life stressors. We also have reducing rumination, so breaking the cycle of repetitive negative thinking, and improving sleep and self-care. Many clients with depression have harsh self-criticism. So CBT can help shift their internal dialogue and increase the self-compassion to help improve energy and motivation. So for instance, a client who stops attending work meetings due to low energy might be encouraged to attend one meeting per week. Then they will gradually increase participation. CBT is one of the most evidence-based treatments for depression, often as effective as medication. Unlike antidepressants, which focuses on neurochemical imbalances, CBT helps clients actively change their thoughts and behaviors for long-term improvement. CBT is often used alone for mild to moderate depression, with medication for severe depression, and in relapse prevention to reduce reoccurrence. Compared to other therapies, CBT is structured and goal-oriented and focuses on skill building and is backed by decades of research. Clients who complete CBT often gain long-term coping skills that help prevent future depressive episodes. So as we learn, CBT provides powerful structural interventions by addressing both thoughts and behaviors. Behavior activation helps break the cycle of avoidance and inactivity by increasing engagement in meaningful activities. And cognitive restriction helps clients challenge negative thoughts and encourage healthier thinking pattern. Problem solving and routine building also helps support daily function. And addressing both thoughts and behavior is key to long-term recovery. CBT is highly effective and empowers clients with lifelong coping skills. Research shows that with CBT research shows that CBD reduces relapse rates compared to medication alone, making it a gold standard treatment for depression. Next, we will take a look at how CBT and their interventions can help with those individuals struggling with PTSD and trauma. Thank you.